Hi, welcome back to UWorld's Next Gen NCLEX review. My name is Samantha and I am a nurse here at UWorld. We are so excited to be back on this beautiful Wednesday. We have an endocrine question drill for you guys. So think all things diabetes, think hypo and hyperthyroidism. We have a lot of insulin questions for you guys. So lots of great content about to come your way. Just a reminder, go ahead and drop your answers to all of today's questions in the chat. We have the fabulous nurse Coley moderating today. So go ahead and drop them in, as well as any questions or comments that you may have. She is there for you guys, so make sure you let her know what questions you have or just stop by and say hi. If you haven't followed us already, go ahead and follow us at UWorld Nursing on whatever your preferred social channel is. We just hit 50,000 followers on our TikTok as well as our YouTube, so we're really excited about that. Thank you to everyone that's subscribed or followed so far, and if you haven't yet, it's just never too late. So with that being said, let's get the chat started. But I'm going to ask you guys, where is everyone joining from? Are they joining from the US? Are they coming internationally? Go ahead and let us know. Alrighty, I'm going to go and hop to our first question. Alrighty, and that's going to be: the nurse enters a client's room and observes that the client is diaphoretic, lethargic, and disoriented to place and time. Which of the following actions would be a priority for the nurse to take? Is it option 1, administer IM glucagon, 2, administer IV regular insulin, 3, prepare the client for a CT scan, or lastly 4, obtain a capillary blood glucose level? Again, it's a priority question, so these are things that we may do all of these, but we're going to do one first. So try and figure it out from that. I see lots of answers coming in. People joining us from Hamburg, Germany. We have a Tanzania, excuse me. Lots of US viewers. Someone's joining us from Liberia. Welcome. We are so excited to have you here. Thank you for joining. We're always excited to see where everyone is coming from. Some Maryland, a Mozambique. We have some really wonderful countries being represented. I hope it's warmer there than it is here. We are freezing in Dallas right now. I'm going to go ahead and see what you guys are thinking in the chat. And the good news is I see almost all correct options. Way to go, you guys. Option 4 was what we were looking for here. So why is this? The client is diaphoretic, so they're sweating a lot. They're lethargic, they're kind of listless, they don't have a lot of energy, and they're disoriented to place and time. These are all describing signs and symptoms of hypoglycemia, or low blood sugar. So what we need to do is assess the blood sugar level, and that's option number 4. That is what's most important for us to do right now. So option 4 was our most important thing. Administering that IM glucagon is more after we check the blood sugar to confirm that we're low. Then we would be giving some glucose to get that blood sugar back up to where we want to see it. But good job, you guys. Again, option 4 was the correct option, or our priority in this case. Alrighty, question 2. The nurse is reviewing new prescriptions for a client with end-stage renal disease. The nurse should clarify the prescription for: option 1 is metformin, 2 is erythropoietin, 3 is acetaminophen, and 4 is phosphate binder. Go ahead and let us know what the nurse should clarify, meaning what prescription are we looking at coming through on the order set, and we're like, I don't know about this one. Make sure you let us know. In the meantime, if you have not already, check out uworldnursing.com. It's a great home base for all of our nursing social efforts. We have a calendar that says our next 3 weeks of topics that we plan to present, the channels we're going to go live on, and the times we're going to present them. So it's a great resource for you all to use. You can also plug in your email and your name and get an email straight to your inbox every single week that lets you know the topics we're going to present that week and the times and the channels. So we have so many great resources for you guys, and most importantly, they're free. So make sure you take advantage of those. Alrighty, I see lots of answers, and I see mostly 1s, a couple 3s and 4s mixed in. Our correct option, you guys got it, option 1. So that metformin. End-stage renal disease, it's also called end-stage kidney disease. This is the advanced state of chronic kidney disease, which is irreversible damage to the kidneys. So we have a great chronic kidney disease live. You can see it on any of our social channels. It's easiest to search back in the history of our YouTube though. So if you want to learn more about chronic kidney disease and end-stage kidney disease. Go ahead and check that out on our YouTube. But it is that decrease in kidney function. It's irreversible. We stage kidney disease by decrease in glomerular filtration rate, or that GFR, which essentially is how effectively the kidneys are able to filter the body's blood. So CKD is most commonly caused by diabetes mellitus and hypertension. What we see here is that decreased GFR leads to fluid retention. We can see electrolyte abnormalities like hyperkalemia, which we know can cause cardiac complications. We'll see an accumulation of waste products in the blood, which is like uremia. But in this case, metformin is going to be contraindicated with end-stage renal disease. And this is because it's excreted in the urine and it can actually lead towards acidosis. So we would clarify this prescription because it's not safe to give in an end-stage renal disease client. The other things would be okay to give to supplement. I know a lot of you, someone asked about erythropoietin. That's going to be a hormone produced by the kidneys. And what it does is it signals the bone marrow to produce and release more red blood cells. But again, metformin was the incorrect prescription. Therefore, it's what we need to clarify. So it would be our correct option. Make sure you're reading the questions in full. That's my biggest tip for NCLEX taking. Alrighty. Question number 3, moving on. So we're switching gears into diabetes now. The nurse is planning care for a client who has been newly diagnosed with type 1 diabetes mellitus and prescribed regular insulin. Which of the following interventions should the nurse include in the client's plan of care? Select all that apply. So option 1 is teach the client to rotate injection sites with each administration. Option 2 is instruct the client to limit oral intake if the capillary blood glucose level is elevated. Option 3, remind the clients that fruits and veggies do not need to be included when counting carbohydrates. Option 4, instruct the client to check the capillary blood glucose level before meals and at bedtime. And lastly, 5, demonstrate to the client how to visually inspect the feet daily. Alrighty, so we're looking for interventions to include, therefore we're looking for correct teachings. Make sure you read the question in full. Is it positively worded? Are we selecting options that are correct? Or is it negatively worded? Are we supposed to select options that are incorrect or need to be clarified or followed up on? And just so you know, uworldnursing.com is a great home base for all of our nursing social efforts. And there actually is also a link there now for our question of the week. So we have question of the day that we put out on all of our social channels that we've been doing for a couple of years now. Now we offer question of the week, which you can sign up for via our uworldnursing.com website. Go to the bottom, click the question of the week link, and you can sign up to get a free NCLEX question straight to your email inbox every single week. So again, we're really upping the amount of free resources that we give to our wonderful nursing students. Make sure you take advantage of these great resources, these free resources too. Alrighty. So I see lots of answers coming in, and the good news is I see almost all 1s, 4s, and 5s, which were our correct option. Good job, you guys. So the nurse is planning care for a type 1 diabetes mellitus client who's prescribed regular insulin. So a quick reminder, in type 1 diabetes mellitus, this is characterized by a complete absence of endogenous insulin. So the body here is not making any insulin. It's because of insulin production in the pancreas has been, it's absent because of autoimmune destruction of those pancreatic beta cells. So we're not making any endogenous insulin. Therefore, we need to supplement with exogenous insulin, i.e. this prescribed regular insulin regimen. So in this case, we're including interventions that are correct for the client's plan of care, which include option 1, rotate injection sites. We want to make sure we're not having irritation, a potential for infection. We're not having scar tissue develop by injecting the same site every time. So we want to rotate it. We also want to instruct the client to check capillary blood glucose before meals and at bedtime. This is describing those AC and HS checks. And 5, demonstrate the client to visually inspect the feet daily. We have a likelihood for peripheral neuropathy, which inhibits the client's ability to sense extremities, especially those feet. We also have delayed wound healing in diabetes. So if they were to get a wound, they may not always feel it, and it can be delayed in the healing, so it can get worse and worse because it's not getting better. So we want to make sure they're visually inspecting the feet because they may not be able to feel a sore or an ulcer. All righty, moving on. Question number 4. So the nurse here is caring for a client with diabetes mellitus who is receiving insulin lispro and insulin glargine. Which of the following statements by the nurse would require follow-up? Option 1 is insulin glargine reduces your risk of developing diabetic ketoacidosis, or DKA. 2 is I will wait to administer your insulin lispro until your meal tray arrives. 3, insulin lispro dosing depends on the number of carbohydrates you will consume. And 4, I will check your capillary blood glucose level 1 hour after insulin glargine administration. Alrighty, remember, follow-up question, it would require follow-up. So we're looking for the incorrect statement. Another reminder, make sure we are looking through our questions and all of our answer options to make sure we know if it's positively worded or negatively worded. Alrighty, and if you haven't already, check out our Nurse Life videos available on all of our social medias. At UWorld Nursing is where you can find us. We have videos that we're putting out that range the full spectrum of the nursing journey. So things about applying for nursing school, making care plans, making concept maps, taking your NCLEX, how to register, what to bring to your NCLEX, and then topics that get into those first few years of independent practice as a nurse. So make sure you're checking those out. If you haven't already, again, they're available on all of our social media channels at UWorld Nursing. All right, I see lots of answers and good news. I see almost all correct options again. Way to go. Option 4 was our correct option. So what we have here is a client that's receiving an insulin regimen. Insulin lispro is going to be a rapid acting insulin. And how I remember this is lis sounds like less, which is like less time. Therefore, it's a rapid acting insulin because it takes less time to work. Insulin glargine, glarge sounds like a large amount of time or a long amount of time, i.e. a long-acting insulin. So insulin lispro is rapid-acting, insulin glargine is long-acting. We're looking for a statement that would require follow-up, therefore an incorrect statement, and that would be option 4. So checking capillary blood glucose level 1 hour after insulin glargine administration is not going to be recommended. Remember, insulin glargine is a long-acting insulin. It covers you for 24 hours, and it doesn't take peak or take set after just 1 hour. So if we're taking that capillary blood glucose 1 hour after giving insulin glargine, it's not going to give us pertinent information about how well this is controlling our blood sugar because it takes longer to act than that. So this would not be indicated. We would not want to instruct this. Therefore, it would require follow-up. 1, 2, and 3 do not require follow-up because they're correct statements. Option 1, insulin glargine reduces your risk of developing DKA or diabetic ketoacidosis. This is true. We know that insulin glargine is long-acting. It covers us for a long period of time, and it overall reduces our risk of going into DKA. I will wait to administer your insulin lispro until your meal tray arrives. Also true. That's a rapid-acting insulin. We want to make sure we give it, and then the client has their meal tray in front of them, and they're eating within 15 minutes because we don't want to have the reverse effect and go into a state of hypoglycemia or have that blood sugar dip. Lastly, 3, insulin lispro dosing depends on the number of carbohydrates you consume. This is true. You want to maintain and intake a consistent amount of carbohydrates, which helps with the dosing. Your provider will look at this and adjust accordingly. So again, option 4 was our correct option. Way to go, you guys. Alrighty, so question number 5. The nurse is preparing to administer insulin aspart to a client with diabetes mellitus. Which of the following actions would be a priority for the nurse to take? Option 1, choose a site on the client's arm for the injection. 2, ensure that the client eats within 15 minutes of receiving the injection. 3, check the client's capillary blood glucose level in 1 hour. Or 4, teach the client about signs and symptoms of hyperglycemia. Alrighty, drop those answers in the chat. Let us know what you think. Again, a priority question, so what is most important for us to do first? And let us know, how are you guys studying? Are you guys using a question bank? Are you using an additional resource like a book or a guide or a video session? Are you going to a live NCLEX review? Let us know how you're choosing to study for your NCLEX. There are new products that pop up, it seems like every day, and we're always so curious to keep our finger on the pulse and see what you guys are using to study. So let us know how you are studying for your NCLEX. I see Sarabi is using UWorld. Wonderful, thank you. Keep letting us know if you don't mind. Alrighty, I see lots of answers coming through. I love it when you guys are interactive. It makes it so much fun. But the good news is you guys, per usual, spot on, option number 2. So we are again giving that insulin aspart. This is a rapid acting insulin. So onset here within 10 to 30 minutes pretty quickly. So because the peak effect takes 30 minutes, to 3 hours, the nurse is needing to ensure the client is eating within 15 minutes. That is our number one priority. We want to avoid a hypoglycemic event, which would happen if they didn't eat and they were given a rapid acting insulin. Option 1, 3, and 4 are not going to be our priority here. So it's important, option 1, to rotate the site of injection, but it's not our priority above avoiding a hypoglycemic event. But we would want to choose a site from the client's, or we would probably use the stomach because the subcutaneous tissue in the abdomen is best for absorption. Option 3, check the client's capillary blood glucose level in 1 hour. If we're giving a rapid acting insulin, what we're going to do is check it before we give the insulin. We always need to have a baseline. What if that client was already hypoglycemic and then we gave them insulin on top of that? We would be bottoming them out, and we don't want to do that. So always maintain your baseline, get your baseline by taking a capillary blood glucose before you give a rapid acting insulin. And lastly, 4, teach the client about signs and symptoms of hyperglycemia. This is something that's important, but it's not our priority above preventing hypoglycemia. So they should definitely be educated on this, but it's not more important than option 2. Alrighty, moving on. Question number 6. Alrighty, so the nurse is assessing a client with hyperthyroidism. Which of the following findings would be consistent with hyperthyroidism? So we're switching gears here. We're out of the diabetes questions now. So would it be thinning hair and cold intolerance, palpitations and an elevated heart rate, weight gain and straining with defecation, or lastly 4, fatigue and prolonged menstrual periods? Alrighty, and I'm just now looking at the answers to my question about when I asked you guys how you are studying, and it's so interesting. I always love seeing this. Chipago is using UWorld, thank you. What else do we have here? Oh, someone says that the UWorld's CAT, or computer adaptive testing, is wonderful. We think so as well. I always love seeing this. Also for fun, because it's our last live of the day, what is y'all's favorite scrub brand? Do you guys like Figs? Do you like the Grey's Anatomy brand? I'm pretty partial to Figs. I think they're fun and they have really nice colors, but let us know. We're always curious. Alrighty, lots of answers coming in. I see Jocelyn is using UWorld. Thank you, Jocelyn. Ooh, and lots of Figs fans. Well, I'm glad to be amongst my fellow people in my company. Alrighty, so I see almost all option 2, and good news, you guys are correct. So hyperthyroidism is going to be the sustained hyperfunctioning of that thyroid gland. And this is due to excess thyroid hormone, which we're going to see those T3 and that T4 are the thyroid hormones. So what we see is the T3 and T4 are through the roof. They're super elevated, but our TSH, or a thyroid stimulating hormone, is decreased or low because we have so much circulating thyroid hormone. We don't need to keep stimulating that thyroid, so we have low TSH, high T3 and T4. This is the what leads to the hypermetabolic state, and manifestations result from that hypermetabolic state. Those manifestations include things like diaphoresis and sweating excessively. Hyperthyroid clients are going to be heat intolerant. They're going to sustain weight loss typically. They're going to see exophthalmos, or the bulging of the eyes from the eye sockets. We can see amenorrhea, or irregular or lost menstrual cycles, tachycardia and palpitations, or option 2. This is correct. We're going to see elevated heart rate being tachycardia and palpitations. We can also see nervousness, insomnia, jitteriness. They'll have GI distress or diarrhea. So again, option 2 was our correct option. It goes hand in hand with hyperthyroidism. Options 1, 3, and 4 were incorrect because these are cognizant, or they make up our symptoms of hypothyroidism, which is on the other end of the spectrum. It's on the low end of the spectrum. So thinning hair and cold intolerance are consistent with hypothyroidism, not hyperthyroidism. We see heat intolerance in hyperthyroid. Weight gain and straining with defecation. Weight gain, again, consistent with hypothyroid. Straining with defecation connotates constipation, which again goes to hypothyroid. In hyperthyroid, we see weight loss and GI distress like diarrhea. And lastly, fatigue and prolonged menstrual periods. Again, this is more consistent with hypothyroid because in hyperthyroid, they're going to be jittery, on edge, and have absence of menstrual periods or irregular menstrual periods. Alrighty, good job on that one. You guys were not fooled, so no worries. Alrighty, last question. We're switching gears again, going back from hyperthyroid to hypothyroid. So think all things on the other end of the spectrum. The nurse here is assessing a client with suspected hypothyroidism. Which of the following findings would support a diagnosis of hypothyroidism? Select all that apply. Is it dry, brittle hair? 2, unintentional weight gain? 3, decreased serum T3 and T4 levels? 4, decreased serum TSH levels? Or lastly, 5, heat intolerance? Let us know. Drop those answers in the chat. And I see someone saying, UWorld rationales are the best. Thank you very much. Alrighty. Oh, someone is a fan of healing heart scrubs. I don't know if I know what those are. I don't think I've seen those, but I'll have to Google it tonight. Alrighty, lots of answers coming in, and make sure after we are done with this question, let us know how many out of 7 you all got correct today. It's always interesting to see. Do we have anyone who's a perfect 7 out of 7? Is someone halfway there? No worries. There is no judgment here. We are just trying to get you across the finish line to pass that NCLEX. And we know we have people that are all, amongst the spectrum of studying. Some of you may have just started. Some of you may still be nursing students, and some of you may be just about to take that NCLEX. So regardless of where you are, we're happy to have you here. If you're about to take that NCLEX, best of luck. If you've taken it and already passed, let us know so we can wish you congratulations. Alrighty, lots of answers coming in. Someone already got a 7 out of 7, which we haven't revealed this answer, so I don't know how you know that. Alrighty, we see lots of answers, so I'm going to go ahead and hop to our correct options, which are 1, 2, and 3. You guys did great on this one. So again, hypothyroidism is a sustained hypofunctioning of that thyroid gland. So what we see is a decrease in the thyroid hormones, decrease in that T3 and T4, but an increase in our TSH or thyroid stimulating hormone, because we don't have a lot of circulating thyroid hormone being the T3 and the T4. That's why we have that increase in TSH, because we keep trying to stimulate that thyroid to no avail. It's not really helping. So what we see here is the clinical manifestations result from that hypofunctioning of the thyroid, and they include things like fatigue, decreased libido. We could have mood changes, bradycardia or that slow heart rate, hypotension. We'll see cold intolerance, constipation, weight gain as an option number 2, and we can even see periorbital edema, which is the swelling around the eyes. And again, decreased serum T3 and T4 levels is consistent with hypothyroid. 4 and 5 were incorrect. For that decreased serum TSH level in hypothyroid, we have increased TSH. This is consistent with hyperthyroid. And lastly, heat intolerance, also consistent with hyperthyroid, whereas in hypothyroid, we see cold intolerance. But way to go, you guys. Be cool, got 5 out of 7. Way to go. I see lots of high scores. Good job. Thank you so much for joining. We had so much fun hanging out today. Come again and join us tomorrow on Thursday at 11 a.m. Central Time and 3 p.m. Central Time. Myself and Nurse in